To health stories now. Advocates in malaria elimination response are encouraging government at all levels to make healthcare a priority by increasing their budgetary allocations for health. They want this done through an increase in political commitment, which they believe is critical for ensuring that allocated funds get released in a timely manner. Health correspondent Kemi Balogun has more details.
This is the fifth edition of this quarterly meeting with the media on its ongoing malaria project. With the political season upon the nation, these advocates are pushing for the need to put issues of malaria prevention and control, as well as an improvement of the country's entire health sector, on the front burner of political activities.
Why should we be losing money that people should have used to feed their children are always being used to buy malaria medicine? And yet, the help that we have largely comes from outside the country. Our people are being forced to take agbo and all kinds of herbs because they cannot afford medical care.
Considering the efforts to increase our political will, government of Nigeria was able to buy SP worth 98.3 million, which is about 330,000 doses of this commodity.
We cannot overemphasize the fact that the gaps are still very huge. We can see that there is a lot of gaps in infrastructure, a lot of gaps in human resources, a lot of gap in the supply chain processes.
Pregnant women and children under the age of 5 are at a higher risk of severe anemia and maternal death due to malaria. This group also wants citizens to play their own part in voting for candidates who have demonstrated commitment towards improving the health sector.
Emphasizing on these political office holders now, because we are in the electioneering period, please do help us tell them to support the Abuja Declaration. We cannot just overemphasize this, which Nigeria has consistently not met up with. It's not, okay, some can even say, okay, it had been captured in their budgets. What is the essence of capturing without release? It makes no sense. It's just singing.
The success of what we do still comes back to political leaders who have a level of power and a range of influence that can be used to spur a large number of stakeholders into taking desired actions in healthcare.
Malaria remains a public health concern, and it will continue to remain so if there is no improvement in the drive to lessen this burden through increased funding, political will, and community participation. Kemi Balogun, TVC News, Abuja.